In this chapter, we will study the role of the immune system in cellular and physiological responses to injury. Part of the chapter is about food allergy, which we will cover when we study the GI system. First, please make sure to review the terminology. If any of the terms on this list is foreign to you, please look it up and make sure you understand the meaning. We all know that the role of the immune system is to protect our system. But let's first talk about how the cells would sustain injury. The mechanism of the cellular injury could be physical. For example, if someone just cut a finger or had a road rash while falling off the bicycle, so that's just physical injury. Or the injury could be caused by deficiency of necessary substances, for example, nutrients. Nutrient deficiency we know can cause different type of injury and diseases. Then interruption of normal processes. So for example, this could be the interruption of a process where our body disposes the metabolic waste, right? Then the accumulation of the waste could come back and hurt the system. So to respond to the injury, our cells could start making certain molecules or compounds that normally we wouldn't make or wouldn't make in high amount. For example, part of the response to cellular injury is that we can find the deposition between different cells and within the injured cells a mixture of collagen, fibrin, and amyloid called hyaline. Recall, fibrin is the protein that is activated through coagulation process, and fibrin protein is insoluble. So exactly how do cells respond to injury or stimuli? First, cells could respond by changes in size. So here are two terms we need to understand: atrophy and hypertrophy. So A in atrophy is for negation, trophy is for growth. So then hyper, we all know what that means. So hypertrophy means overgrowth, atrophy means inadequate growth. So the best example to see this is, let's see, this gentleman obviously is doing resistance training, and we know that would build the mass of muscle. And we know the number of muscle cells don't change. So when the muscle mass increases, that means the size of individual muscle cells increases. So we can see in the figures on the left, the size of normal bicep and the size of atrophy when it occurs to a bicep. Definitely, muscle undergoing atrophy is smaller in size. Cells can also change in the numbers, types, or the way they grow. For example, we already studied hyperplasia. So that's when we talk about the obesity lecture, for example. So here in male prostate, we can see what will happen. So we know for men, once a certain age is reached, prostate enlargement is quite common, which could lead to very discomfort situations, especially during urination. And patients may have to adjust their body position during urination to help the process. So What happens here is that um, if it is not a prostate cancer, that's a condition we call the benign hyperplasia. Benign hyperplasia. So we can see the number of the cells increased. And another example is that the three figures on the right, we can see the female cervix, right? So we know the normal cervix on the top is covered by squamous cells. So basically, they're just like the tiles, almost like the scales of the snake or a fish. So they're very flat and cover. So these cells are basically lining the border, lining the border. But in certain conditions, we can see deep down, we have some cells growing abnormally. We call the dysplasia. We can see embedded in the normal pinkish cells, we see a few red cells look different from the cells surrounding them. So they are abnormal. And then further development, we can see increasing number of moderate dysplasia. So we can see more abnormal cells basically in between the normal cells. So when we do the inspection of the cell types, the physicians could see and count how many abnormal cells are within the microscope. So that would be a good screening tool for cervical cancer among women. So that's actually a very easy and low cost screening tool. Then the picture on the left, lower left, is a picture of the esophageal lumen. So we can see definitely, say this side of the lining is pinkish, whereas in this section close to the lumen here, we can see definitely more red. That's what we call the Barrett esophagus. We will study this condition in the GI module. But what happens here is that when we see Barrett esophagus, that means the lining of the esophagus was damaged repeatedly by gastric acid reflux, for example, GERD. So we know our body wants to repair the damage. So every time it's damaged, we try to repair. But then next time acid comes up again, then damage it again. So this type of repetition over time actually opens the door to change the type of cells. And that means at the same time it would open the door for carcinogenesis. So cancer could develop out of this process. So that's why we see a lot of say chronic infections, for example, especially chronic viral infections, is a risk factor for certain cancers. For example, hepatitis B, HBV, is a risk factor for liver cancer. So just to summarize a little, when the cells are undergoing injury or certain stimuli, the responses could be alterations in cell size, cell number, cell type, or the way they grow. And this could be a repairment or at the same time could lead to other pathology. Probably the best known function of the immune system is the ability to protect us against infection. So how can cells suffer from infection? Well, for us to have an infection, there has to be some factors. For example, we have to have a pathogen present. So whatever the microorganism that causes the infection need to be present. They have to contact with our body. At the same time, our body, basically the host, has to be vulnerable enough to allow basically the pathogens to invade and cause the condition. Then, of course, the environment has to be conducive to proliferation of a pathogen. So this, I would encourage everybody to review the SurfSafe information you all learned earlier. So remember, there's a danger zone when it comes to temperature and humidity, basically the amount of free water available for the pathogen to grow in food items. So here, the environment, when we talk about the host and the surrounding environment, the principle is similar. So basically, there is an environment that may be conducive or not for the proliferation of a certain pathogen. So that's why sometimes to fight infectious disease is not just antibiotics or give the host, the individual, more protein. Among other things, we also need to do something about the environment. For example, we want the air of the room to be fresh. We want a certain ventilation going on. We don't want certain temperature to be too much or too low, things like that. So the susceptibility of the host is influenced by many factors. A lot of these factors are not modifiable. For example, age and gender. And in certain cases, say hormonal imbalance could also lead to this vulnerability, and the stress. Right? We already mentioned stress is known to cause suppressed immune system. But there are also factors that are modifiable. For example, nutritional status and physical activity. Right? People who are well nourished, who are physically active, statistically they are less likely to contract infectious disease than those who don't. So this is already known. So therefore, that's a part of the strategy to fight infection, basically by maintaining or improving nutritional status and increase the physical activity level. We are making the host less susceptible to infection. The types of microorganism that could cause infection are listed here. The best known are bacteria, fungi, and viruses. Infection is most likely when the microbes can produce exotoxins, endotoxins, destruction enzymes, or spores. So regarding the two toxins, again, please review the relevant information in SurfSafe. Remember, there are certain food items after a period of time we just have to dispose. Keep reheating it won't do it. Why? Because once the item stays in the danger zone long enough, although reheating it may kill the bacteria, but it may not be enough to destroy the toxins secreted by the bacteria. And the toxins could still cause people to be sick, right? And then when they have say bacteria have spores, that means they could go dormant and bypass all the mechanisms of detection. And then when the environment becomes conducive again, they can come back alive. So that means it's very hard to kill them off. Yeah, for specific information, please review microbiology about bacteria, the life cycle. The course of infection overall has 4 stages. First is incubation, which refers to the time of a pathogen's entry into the host body to the manifestation of a clinical signs and symptoms. So basically, from the time of invasion till we could know this person is infected. So depending on the pathogen, the incubation period is different. And this is the time actually basically could be dangerous because the person is already infected, but without any clinical signs or symptoms. So that means this person could be getting around and pass it to other people. So that's why when we deal with infectious disease, there's always a quarantine period. And depending on the disease, the required quarantine time is different. For example, I believe the quarantine time is for Ebola is 21 days, 3 weeks. So let's say if someone traveled to a region where Ebola had an outbreak, so when this person come back, then this person may be put in quarantine for 21 days. Why? So if after 21 days this person doesn't exhibit any clinical signs or symptoms for Ebola, that means this person wasn't infected. Then this person can return to his or her normal life. So that's basically the science behind the quarantine practice. Then the next phase is prodromal. So basically that refers to the first and vague symptoms. So start to display some signs and symptoms, but may not be crystal clear. Right. For example, people with measles, usually they had a certain skin rashes, all that would come up, but it may not be the first thing. They may start by having fever first. Well, that's not specific. That's why we say at this time the symptom could be vague, because a lot of other diseases could lead to fever. Okay. Then the next phase is what we call the acute phase, meaning the disease is in full blown, right? So all the classic signs and symptoms are in full manifestation. At this point, we shouldn't have any doubt which disease we're talking about, we're dealing with. And of course, if the patient survives, then the last phase would be recovery. So then gradually signs and symptoms disappear, the person get better. In certain cases we'll talk about, they may develop a lifetime immunity. They would never get infected by the same microorganisms again. For example, measles. So if the person survives measles, the rest of his or her life, there won't be another measles infection. Then part of the response to cellular injury is death. So here we need to be very clear regarding the difference between death by cellular injury versus programmed cell death, which we already studied, called apoptosis. So for disease, cell death, we refer to necrosis. And also we can say tissue death, also necrosis. For example, let's say someone suffered from a heart attack, then part of the cardiac muscle died, so we can refer to that as a necrosis as well. We talk about that in addition to the presence of a pathogen, host susceptibility is also a factor that allows infection to happen. So the good thing is our human body as the host actually has a resistance system with multiple components. For example, our skin and the mucous membrane literally form physical and chemical barriers. So if our skin is intact, right, a lot of things will be stopped at that skin. That's it. Then we can wash it off. It will not cause harm. So what do I mean by the chemical barriers? So let's say think about the gastric acid, for example. We have that in the stomach with very low acidity, and then that could kill the bacteria. So that is not a physical barrier. We may still ingest certain bacteria into the system, but they will be killed by the chemical environment. And also, our skin, for example, has a pH, and that could also kill certain invaders. Our body could secrete different things, including saliva, tears, and gastric juice. We mentioned that. So, for example, in saliva, in addition to digestive enzymes, we also have basically the molecules that could kill the bacteria. So, as we chew food in our mouth cavity, in addition to the initial digestion, this kind of killing of the invader will also occur. And our tears definitely it wet our cornea, but also it can kill the bacteria. It has the enzyme. Lastly, we have a very complex and advanced immune system, which is involved in launching inflammatory responses. And this could happen without underlying diseases. So we'll talk about how and why. So the natural resistance in the body, summarized in this figure, is quite good. For example, we already mentioned the skin. Our earwax, right? Our earwax also serves as a physical barrier. Let's say if any bug want to get inside, it will be very difficult to go through earwaxes to reach the bottom of the canal, because that's where the drum, very thin layer, is located. We don't want it to be destroyed. And then also in our airway, we have the cilia lining trachea. Basically, we have the tiny hair-like structures. They would all move upwards. So that's why if there's any object by accident fall into the airway, of a cough reflex would push it out. And if not, let's say if we have basically pollution, dirt, pollen through that breathing process, those basically cilia could push them out of the say airway when we cough, when we sneeze. So that's a way for us to dispel those foreign objects. So please go over other items in this figure to see if you could see why we say this is a natural resistance. To prevent transmission of infection, right? We call it infectious disease for a reason, because it's passed from person to person. But we want to stop this, right? So we have different ways to stop the transmission. For example, we can use disinfectants. So, for example, bleach. When we say disinfectants, usually we're using it on non-living objects. For example, we could spray disinfectants on the countertop. We can also use antiseptics. When we say antiseptics, we're talking about using them with living tissue. For example, before we say the surgeons cut the skin, we would basically apply betadine and alcohol at the site of incision to kill the bacteria there. So that's antiseptics. Through heat and chemical treatment, we could also reach a sterilization, basically kill the living things in the item. Or we can use a personal protective equipment. For example, let's say if there is an infectious disease outbreak, the healthcare providers, emergency team, they have to be there, right, control the condition. But we definitely don't want the emergency responders to get infected doing their job. So what equipment could we supply them? So here's a summary from the table, right? We could use gowns, we could use gloves, face protection. Sometimes we have to wear masks, and we should remember to wash hands or other skin surfaces. We don't want certain things to stay on our skin for a long time, and also avoid accidental injury. And there's a reason why, say, people at work deal with sharp items will have to receive a mandatory training on how to safely dispose them. And for those of you who have experience or have seen those, you see special red container, really that kind of tamper-proof, so you cannot just open it and let it spill out. So for a reason. So as you go through your clinical rotations, anything, we mentioned that before, anything posted on the patient's door, please read carefully before you enter the room. Before we mentioned it could be a NPO sign to remind everybody, doctors, therapists, nurses, and dietitians, that this person shouldn't consume anything by mouth. Right? As a dietitian, we have to know. Or the sign could say, okay, so you have to wear gown and wear gloves before you enter. Why? This person may have a C. diff infection. Right? So make sure you read the signs posted. And in many cases, when these type of personal protective equipment are required, more likely there will be a card by the door. In addition to the sign, whatever equipment, for example, gowns and gloves needed to see that particular patient, the card should already be there, so that whoever needs to see the patient can conveniently put them on. So please be observant, no matter how busy, how tight our schedule is. Make sure to read the signs posted and see if there's a card outside a certain door for a good reason. So now that we talk about the type of injury, mechanism of injury, and overall reaction to injury and natural resistance, we are moving on to the immune system. The functions of the immune system are many, but overall it's to defend our body from antigens. We'll talk about what antigens are. And also, by doing that, it actively promotes the homeostasis. Our body environment, internal environment, will remain relatively stable. And what's more important is that the immune system can provide a surveillance system. It's not just like, okay, when there's an invader, I start to fight. After that, I forget about everything. No, not really. Our immune system after the fight often develop a memory and a surveillance system. And so next time we see similar antigens, we can quickly identify and neutralize it. So preventing it from further spreading. The four basic requirements for our immune system are specificity, diversity, adaptability, and the ability to respond to new stimuli. So basically, our immune system has to be able to identify a specific target, the disease-causing antigen, and do something about it. And there are many types of antigens. So all the diverse antigens we have to deal with, our immune system has to be able to deal with every single one of them. And sometimes things change our immune system will have to update the surveillance system or the memory to go with the latest. And then whenever we encounter a new stimulus, our immune system, although never encountered it before, should be able to develop something over time. So what are antigens? Antigens allow the immune system to recognize potential pathogens and foreign cells. So we can consider antigens markers. So this could be a molecule or it could be a portion of a molecule. But anyway, this marker allows the immune system to recognize, okay, this is a pathogen. So this is a disease-causing entity. We have to destroy it. Or this is a cell that has been infected. We need to confine it, deal with it, and doesn't allow it to spread it to other cells. Related to the antigen, we have another term called immunogens. Immunogens are antigens that can induce an immune response. So let's think about the definition. Immunogens are antigens that can induce an immune response. So antigens is the marker for potential pathogens and foreign cells, but some antigens can lead to an immune response, which is what we want, right? We want the immune system to respond to the pathogen or the foreign cells or the infected cells. There are two types of immunity our immune system provides to the body. One is called innate immunity. The other is called acquired immunity. What's the composition of the immune system? If we look at this figure, we see different organs and tissues in the immune system. If we look closely, we will notice, unlike other systems, like for example GI or the motor system, or the nervous system, right, which are connected. For example, GI tract, although very long, but it's one single tube, right? Narrow or wide at the different sections, but it's one continuous tube. That's GI tract. However, if you look at the central organs of the immune system, the bone marrow and the thymus, they are very far, right? This is thymus behind our sternum bone in the chest cavity, and then we have the bone marrow here. They are not connected. Then if we look at the peripheral organs of the immune system, right, different lymphatic tissue in mucosa, bronchial, basically in our airway, and in our gut. So they're in GI, they're also in the respiratory system. So they're not physically connected. So that's a major difference between the immune system with most of the other systems. Another example or the exception is what the endocrine system. The endocrine glands, they are not all physically connected. In the immune system, we have many different immune cells, different types of immune cells. We already talked about macrophages and monocytes when we studied atherosclerosis. We mentioned, right? So monocytes are circulating in the blood, but macrophages are localized in tissues. And their job is to engulf the target. It could be the bacterial cell or it could be an infected cell. Then we have PMN leukocytes. So leukocytes, white blood cells, polymorphonuclear. So the nucleus of the white blood cells, have a different shape, right? Polymorpho. So if we look at the pictures in the on the top, we can see certain cells with very dark dot, different lobes within them. So those are the PMN leukocytes, and the dark dot lobes are the nucleus. We can see it's not just one piece, it have different dots. That's why we call it a polymorpho nuclear leukocyte. We also have other cells from stem cells. For example, we have mast cells. Mast cells are responsible to allergic reaction. Then we have Langerhans cells and dendritic cells. So all the cells have different roles, and it's quite specific actually. We simply don't have enough time to talk in much more detailed manner. For lymphocytes, these are the ones we need to focus on, right? So there are also different types. So T cells, T as in thymus. So that means these cells mature and differentiate in thymus. T cells mediate cellular immunity. And there are different types of T cells. And the T cells can stimulate B cells. We'll mention what B cells do later. So what types of T cells do we have? We have helper T cells. So they are the, let's say, coordinator or the dispatcher. We have cytotoxic cells. They are the ground infantry. We also have the regulatory T cells. So pretty much they are the administrator. So they obviously, some of them control the policy, others do the coordination, then the remaining would go out to the field to do the fighting. And molecularly, different type of T cells has different cell marker. For example, helper T cell has a hallmark cell surface marker called CD4. And we have a cytotoxic T cells with the CD8, right? So in certain situations, we have to require a proper ratio of different types of cells. For example, if someone is infected with HIV, the issue is that his or her CD4 cells will be very low. So the immune system won't be able to coordinate to launch effective immune responses to protect the body against infections. So that's why when it progresses to a certain stage, HIV positive individuals may get sick more often because of that. Yeah. So this figure shows how different type of T cells basically work. Right. So we can see the differentiation. We have immature T cells, right, with macrophages, right, presenting the yellow dot, the antigen, to the developing immature T cells. After that, so pretty much here, this is the, say, target you want to memorize and be able to identify later. Okay, so we can see upon differentiation, we have a mature helper T cells with the CD4, okay, and with the yellow dots. Okay, they learn the lesson, okay, which are the bad guys. Then we have the mature cytotoxic T cells with the CD8. So these are the attackers. So different type of T cells, they would coordinate to make the immune system, the immune response targeted and focused. Then we have the B lymphocytes. B as in bone marrow, right? So they mature in the bone marrow and mediate the humoral immunity. So B cells can be stimulated by antigens or by messages passed on from T cells. There are different types of B cells. One is plasma cells. So plasma cells are responsible for producing antibodies. So please note here, plasma cells, this is a term, specific term, referring to the type of B cells that produce antibodies. It doesn't mean any cells in the plasma. So please make sure this is a term by itself, plasma cells. Then we have memory B cells. So remember we say the immune system could develop a surveillance and a memory. So this is where the memory comes from. So after the fight is over, these B cells will remember the information of the pathogen or the antigen our system just fought against. The next time, if we encounter the same pathogen or antigen again, then we could, our system could quickly organize an immune response so that we can stop the process early on. Lastly, we have natural killer cells or NK cells. So the name indicates they are natural killers. So they are very important in the surveillance in the body, and particularly in cancer immunology. The good things about natural killer cells is, unlike say T cells or B cells, they may need stimulation or the messages passed on from other type of cells. Natural killer cells could do it on their own, almost like they're some independent marshal, right? They're not listening to the county sheriff or the city police. They're on their own. So it's very important for cancer immunity. We mentioned that plasma cells are responsible for producing antibodies. We already mentioned this term many, many times. At least we mentioned all antibodies are proteins, right? Another term for antibody is immunoglobulin. So globulin refers to a protein in the shape of a sphere, a ball shape, right? Immunoglobulin, basically a spherical protein that has immune functions. Short form is Ig. There are 5 classes of immunoglobulins. So G, A, M, D, E. So they are secreted by different tissues in different amount, in different stages. So we have mentioned a few of those. For example, in life cycle, when we talk about the breastfeeding practice, right, we know that's a good practice for both the mother and the newborn. So, but in certain cases, we say, well, even if 6 months of breastfeeding is not possible, at least we would want the newborn to get the first 3 days of breastfeeding. Because why? That's where colostrum is secreted, and that's when the newborn could get a preformed IgA from the mother to protect the baby. And for those of you who know, during the first 6 months after birth, the baby seldom gets sick. Why? That's because a lot of the immunoglobulins passed on from the mother are still functioning. But all proteins, antibodies included, have a half-life. So over time, when they are turned over and the baby's immune system hasn't been fully developed, then that's when after 6 months they start to get sick more frequently. So the structure diagram of an antibody we can see is a Y-shaped structure. The blue chains we call the heavy chains. Then we have the basically shorter ones called light chains. So if we consider this Y-shape, let's say a plant, the stem is quite stable in terms of the DNA sequence, the amino acid sequence, right? but the flower, the leaf, basically the branch part, are the variable part. So basically, that part will be specified based on which antigen we're talking about. So we produce this antibody to recognize and attack which antigen. Okay, then this basically variable part here, we'll see, will be different antibody by antibody. We also have another mechanism called antigen recognition molecules. So we have MHC or HLA, major histocompatibility complex. Another term is human leukocyte antigen. So these antigens, these complexes, are critically important in transplant. So they play a role in susceptibility to some autoimmune and infectious diseases. And these are the ones, let's say we say an organ donor and an organ recipient, we say it's a perfect match. Exactly what's matched? It's HLA matched. So there are a certain number of sites we want to check. We say if it's a perfect match, that means all the critical sites we check matched. Imperfect means, okay, some critical sites matched, others didn't. Of course, when someone goes through a transplant surgery, we would want the newly acquired organ to work. So the higher the match rate of the HLA antigen, the better the chance for the organ to work. So basically, if it's a perfect match, the rejection reaction will be less likely to happen. Of course, other measures should still be taken. We also mention molecules. So far we talk about the organs, tissues, and cells within the immune system, and we already know they are not physically connected. For example, B cells, T cells, they're all in the blood, and then we have a different, lymphatic tissue in different tissue. So how you're saying how the immune system coordinated attack, how, when everything is so distant from each other? The answer is that we have different molecules in the immune system can serve as the messengers among different, say, immune organs, whether it's central or peripheral organs. The first one is complement. So complements are plasma proteins. So they actually are helpers to the antibodies. So we already know antibodies are proteins specifically produced to attack a particular antigen. Complements are helpers. So they're not specific against, say, this virus or that bacteria. However, they help make the attack by antibody to the antigen or the pathogen more efficient. So the name is very descriptive. They are complements. They are not the major, say, soldier, but they assistant. They are good assistant. We also have cytokines. In obesity module, we already learned cytokines are hormone-like molecules. So they are not called hormones, but they are definitely messenger molecules. So depending on the cells that secrete different cytokines, we could call certain cytokines adipokine, meaning they're from adipocyte, fat cells. In this case, we may say, okay, this is a lymphokine, meaning the cytokines are from lymphocytes. The most commonly known cytokines for the immune system are interleukins. Short form is IL, interleukins. So IN indicating it's a protein, leu as in leukocyte, white blood cells, inter, between, among. So the name means these proteins do the crosstalk among white blood cells, interleukins. By now, there are about 20 different interleukins. So you will see IL-2, IL-6, IL-18, things like that. Sometimes you even have a number followed by a letter. So basically, they're subtypes of the same type of interleukin. We also have INF, interferon, which actually is used in fighting viral infection as a treatment. And the TNF, tumor necrosis factor. So we learned this before as an inflammation marker, and also introduction to malnutrition and in heart failure. This one also comes up as an indicator of the severity of the condition. So now you know why we say this is an inflammation marker.